Good morning, everyone. Hello, hello. This is our very first morning broadcast, and I hope that we hope we get our audience from Europe and Africa, and for those of you who are on the west coast of the United States, I know it's a little bit early, but we are glad if you woke up and came to join us this morning. Welcome to Lipedema Wellness Conversations with Gail and friends. And today our friend is Dr. Carlos Zumarraga. He is from Merida, Yucatan, Mexico. And so he has a clinic there called Clinic Keto, which he is the founder and owner of. And so I would love for everybody here who's coming in to listen to us this morning to please tell us where you are from. Looks to me like we have Carol Lynn from Mesa, Arizona. Hi, Carol. Also, make sure that you hit the hearts or the likes, the thumbs up, the likes or the hearts. Make sure you hit those for us so that we get that going this morning. Dr. Carlos has been working with us for about a year. If it sounds like I'm yelling, I'm sorry. I'm pretty excited. And um, okay, so Facebook user is from Hudson Valley. Hi. Um, so Dr. Carlos comes to us today from Mexico, and I would like for him to give us a little bit of his background. So, Dr. Carlos, how did you get started working with keto? Can you tell us your journey?
Sure, Gail. Thank you very much. So it's a pleasure to be here. I started doing the ketogenic diets as a treatment for chronic disease and diseases of, we call it civilization. These are the diseases that start happening in the communities when we start changing the way we eat from an evolutionary point of view. So the main factors that change the way we get sick is from chronic disease is the way we eat, and the increase in sugar and refined sugar and vegetable oils are very important also. And getting away from protein and fat, that is what we should be eating as our species evolved to eat. So I started years back, maybe 2016, 17, doing the ketogenic diet for diabetes and obesity here in Mexico. And, the kind of diseases that I've been treating after that have been a lot. I mean, we are treating patients with brain problems like, for example, Alzheimer's disease. We are treating patients with gastrointestinal diseases like reflux or gastritis, colitis, autoimmune diseases like Crohn's disease and ulcerative colitis that are from the GI tract. And we treat also diseases associated with insulin resistance or hyperinsulinemia, like the ones that I have mentioned, that is obesity and diabetes, and also polycystic ovarian syndrome, infertility that is caused by this disease. Yesterday, for example, we have a patient that after 6 months on the ketogenic diet could get pregnant, and she was very happy for that. So we are very happy also for her and family. And we treat also liver diseases like fatty liver disease, the complication of fatty liver disease, that is hepatitis, that is NASH, non-alcoholic hepatitis, steatohepatitis, that is a complication of fatty liver disease. And the list, go on and on and on, including lipedema and lymphedema. In the patients with lipedema and lymphedema, they are different kind of patients. Usually lymphedema, it's a problem that we see in the oncology patients that are going to surgery, and they have the removal of the lymph nodes, and they develop accumulation of fluid in the extremities. That is something that is common here in Mexico to happen. Lymphedema, for example, in other countries it can be by a parasitic infection, but in Mexico, in the US, and in Canada, in these countries, what we see is a surgical problem is after the treatment of cancer that we see the lymphedema. And lipedema is it's also one of the main diseases that we treat here in the clinic. It's a disease that is, as you know, Gail, is not recognized by the medical community so much. So the patients have difficulty to get diagnosed and treated. And when they get diagnosed, the treatment, it's kind of nobody knows what to do. They go to surgery, if they do conservative therapies, if they do a low-fat diet, high carbohydrate diet, if they go to a ketogenic diet. So this is what we have been studying in the application of ketogenic diets in lipedema, and in our work with Lipedema Simplified, we have seen the results, and also here in the clinic we have seen amazing results in the lipedema patients.
So when you first joined us a year ago, or approximately a year ago. I can remember you telling us that you did not know very much about lipedema. You had heard about it. You became very interested in it. And so tell me, how has your practice evolved? How has it changed? And are you seeing more and more lipedema in your patients? Have you started diagnosing them? How has your practice evolved?
Yes, definitely. The first contact that I had with lipedema was in the conference, and Leslie Kidd, that is one of our team, our team is one of the leaders of the lipedema team. She gave a conference about diagnosing and treating lipedema and the ketogenic diets, and I saw the presentation and I realized that some of the patients that have obesity, they also have lipedema. So it's not only they didn't have like classical obesity, but what they had was lipedema. And so I start observing more my patients and studying more about the lipedema, how to diagnose lipedema, and I start seeing that the patients that come to the clinic, some of them they do have lipedema, and they start diagnosing and treating the patients, and so that was the start. And here in Mexico, we do have a community that have lipedema. That they are there are small groups of people that they get together to talk about the lipedema, to find answers for the lipedema community. And some of these patients have come to the clinic for treatment, and so the practice is growing in this fashion. I mean, we are having more and more patients because they exist in the community, but they didn't have any place to go. So they start coming to the clinic because of the understanding of the pathology and the treatment that we have.
Oh, that's nice. So like the rest of us, most of those of us with lipedema, we don't know where to go to get diagnosed. I mean, that's one of the biggest issues. And some of us don't even realize that we don't have what is called classical obesity. We just think that we just think it's regular obesity, and we struggle with it for so long. When you came on, we got really excited because not only do you use the ketogenic way of eating to help with the lipedema symptoms and some weight loss, but you've also found that many of your patients are able to get off medications.
Yeah.
right? So,
Yes.
how does that look what does that look like in your practice as patients get off medications?
Yeah, this is very interesting because every patient is different, and usually the patients with lipedema are kind of protected from developing a metabolic, the metabolic syndrome and diabetes because of the way that the fat is stored in the subcutaneous tissue. So, in a way, storing fat in the subcutaneous tissue is a protective mechanism for to develop metabolic disease. But some patients also have metabolic disease and they have lipedema. They may have prediabetes or diabetes, and they are taking medications. And one of the problems with all of these group of diseases is that they have a component of hyperinsulinemia. This is the elevation of insulin, even if the glucose is not elevated. This is called diabetes in situ, and is the first stage of diabetes and metabolic disease. So usually the treatments for these diseases or for diabetes, for example, it's to reduce glucose. So it's focused on reducing glucose, and it's not focused on reducing insulin. But the patients have a lot of insulin. So giving more insulin to a patient that is already producing a lot of insulin just makes the disease worse. For some time you can get a little bit of improvement in glucose, but the disease progresses because you're feeding the resistance, the insulin resistance, and you're feeding the hyperinsulinemia. You're making the pancreas produce more insulin. And this in the lipedema is something that it's a bad situation also, because the more insulin you have, the more fat storage you have. So this makes the lipedema fat worse. So the fundamental therapy of the ketogenic diet is an insulin reducing diet. So by reducing insulin, we start seeing the improvement in the metabolic condition, the adiposity, the removal of the adipose, the subcutaneous adipose tissue that is the problem in lipedema. So we start seeing the reduction of edema, the lymphedema that is developed after the lipedema, because you have better drainage, because you don't have so much compression in the extremities and in the lymph vessels. So you start seeing everything improve. So we start decreasing medications objectively in a way that, if we have a patient with diabetes, we follow the glucose and we start decreasing the medications as the glucose is improving. And so many times we can stop the use of insulins or medications, like, for example, medications that increase the secretion of insulin in the patient. We can stop, and we should stop, for example, the medication that is called the flosins, that are the medications that increase the secretion of glucose in the kidney. We have to stop those because are not indicated with the ketogenic diet. So there is a lot of modifications that we have to do when we take a patient that is not, it's not just treating the lipedema, but it's treating, the whole patient.
Right, right. And so many of us, we watch our blood sugar numbers, and really it's the overload of insulin, because it seems like those of us with lipedema, our pancreases are really happy just cranking out the insulin for us, which makes us store it. Before we go any further, so there's a couple of I wanna say hi to some people. We have, Ruth Gaw and Julie Stewart, Pat Smith. They are from here in the United States. So is Beatrice, she's from New York. Um, Cheryl's from Wisconsin. Tori's here from France. Hi, Tori. Welcome. We have Cindy, Statler. She does have a question. She wants to know if you're from Pittsburgh or Mexico. You're from Mexico. And then Cindy has said, I would like to make an appointment. You do consultations. I'm going to put your your email address across the bottom for anybody who wants to send you an email. Let me go back to the chat here. Laura is here from New York. Doreen's from Colorado. And then Tori says, I'm new to this, but I'm reading, she says, I'm new to this, but I'm reading that the keto diet helps. And we are discovering that the keto diet helps. It doesn't cure lipedema because that's not what treatment is about with lipedema. We manage it, and we can slow the progression. We can sometimes, it appears to stop or reverse some of the progression. So as far as what you see in your patients, the symptoms or the expression, how does keto, what results has keto given your patients?
Yes. So there are many good things that happen with the ketogenic diet in lipedema. So, for example, we can remove a little bit the lipedema fat. That is what we call it. That is the one that is located in the hips and the legs and the arms also. So we can remove a little bit of that fat that is very difficult to remove by other means. And so this is one thing. The patient will lose weight. The other thing that we see is that if the patient is accumulating fluid, the fluid will get better immediately. I mean, in 3 weeks, we see improvements in the drainage of the fluid of the ankles, for example, or the feet. That is where you accumulate the fluid more because it's the fluid that is distal, so it's far from the heart. So it has to do all the traveling, and you have all the obstructions. And so by removing the lipedema fat and improving the functioning of the lymphatic vessels, we see a decrease in the fluid immediately. The other thing that we see is decrease in pain. The patients with lipedema have a lot of pain in the lipedema fat, and this improves as well, maybe because of the ketogenic anti-inflammatory effects of of changing the diet. The other thing that we see is the patients improve mobility, so they start moving around, maybe from the place that they are at this moment, they start improving a little bit. Every patient is different, but they start doing daily activities. Some patients can get out of the wheelchair, for example. Some patients can, take a shower easily because of the weight loss and all the improvements that we are seeing. The patient gets better quality of life, and there is a relationship, for example, between the independence that the patient is gaining with the mood of the patient. So many patients with this condition can get a little depressed, and having independence improve this depression of this mood. It improves, and also the properties of the ketogenic diet by nourishing your body with protein and fat. It's good for the brain, and also the variability of glucose in your brain is also very important. So when you're eating carbohydrates, your brain is getting energy and then getting low energy and then getting a lot of energy, and this is not good for the mental stability of the patients. That is what we are seeing now in the patients with neuropsychiatric problems. So by stabilizing the glucose and having the brain use ketones as a source of energy, we see improvement in the mood of the patients. So there are a lot of hallmarks of lipedema that are improved by the ketogenic diet.
Right. And if any of our our listeners want support from somebody about either getting started, or they have questions about, say, their health. Some of our doctors here in the United States, I will tell our patients, our clients, that that keto is bad for your kidneys, or keto is bad for your liver. And I do know that you worked in for liver health, correct?
Yes.
And I know, and Dr. Fung has worked with kidneys. Um, and so, what have you seen? Is keto bad for the liver, or the kidneys? Is it healthy for us?
Yes, I mean the ketogenic diet is, we have to go back in, evolutionary times. So maybe the ketogenic state for the human is the normal physiological state. Even if we eat a little bit of carbohydrates, but our protein and fat it's predominant in the diet, we will be in a ketogenic state. So, ketosis is not something that is extreme. It's something that our body can do easily uh, when we reduce the amount of carbohydrates or sugars in our diet. So, in liver, for example, many diseases of the liver, or the metabolic diseases of the liver, they get better immediately as well. I mean, in 3 weeks, we can see improvements in liver enzymes, for example, in patients with hepatitis from fat or fatty liver disease that is complicated with inflammation. We see improvement in this marker, and we remove the fat in the liver that is called ectopic fat, that is fat that is not where it should be, and also in the pancreas that is called the fatty pancreas, and this is part of the pathophysiology of diabetes, type 2 diabetes. So we remove all the visceral fat, the ectopic fat. The liver just works well. I mean, there is no problem with the liver. It's healthy for the liver. Also for the kidney, when the patient, the number one cause of kidney failure, it's diabetes. So also very closely, it's hypertension. I mean, hypertension is also a problem for the kidney. And these two problems are part of the metabolic syndrome. So the ketogenic diet fixes the metabolic syndrome and reduces glucose, reduces the damage done by the diabetes. So the kidney in the patients usually, if the patient has diabetes, the ketogenic diet is therapeutic. It's not only not bad for the patient, but it's good for the patient and for the liver for the kidney function. So but we have to stratify the damage done in the kidney. If the kidney is completely gone, then some modifications have to be done. But if the kidney is working and it's just having a little bit of problems because of the glucose or the high blood pressure, then doing the ketogenic diet will be healthy. So,
Yeah.
and for a normal healthy patient that, the lipedema patient that is metabolically healthy, the ketogenic diet is good for the patient. So it's no problem there.
Thank you for that explanation. I do know that we get that question quite often, um, among our community, and so by having that explanation, that really helps our community members, because they have to then pretty much defend themselves.
Yeah.
They have to advocate for themselves when they go into their doctors.
Yeah.
It's because of everything that we deal with. The members of our community always have to. It's like they're pushing up against their doctors,
Yes.
and they have to they really need to come armed with
Yes.
information. So I really appreciate you being here today. I do want to let the community know a few things that are happening. First of all, I have Dr. Carlos's email address with Lipedema Simplified scrolling across the bottom. Um, if you look um, on the announcement of this broadcast, you'll either see it above if you're on Facebook, or you'll see it below if you're on YouTube. There's a link in there for a free webinar that's starting this Thursday. The first The first person who will be speaking will be Dr. Leslyn Keith. Her webinar's Thursday. I will be the host of the webinar that happens on Monday, and then Catherine will be the next one, and then all of us will get together for the final one. So there's a free webinar series, four webinars in there. Also, we have a big event coming up in October, and Dr. Carlos will be there for his for coaching corners, and some question answers. And then also, Dr. Carlos is going to start working on some projects with us in Spanish for our Spanish speaking community. He has already helped us with some of our translations. So we do have some documents and some brochures that are also in Spanish. And so, Dr. Carlos, it was wonderful for you to be here today. I'm looking here. We've had a couple of questions. Tori has one more question, and let's see what we can do with one more question from Tori. She is in France, but she lives in Arizona. And it says, I also have read some about lymphatic drainage. Should I request a physical therapist treatment from my PCP? And I'll answer that. If you can go physical therapy from your PCP, or you can ask for certified lymphatic therapist. That's a CLT, and they can do some decongestive therapy. They can suggest follow-up treatments, for example, teach you how to do manual lymph drainage, show you which compression to wear. As you notice, I wear compression on my arms, and those sorts of things, and they can help you with that. So if you have any questions about that, you can always reach out to me, also Gail at lipedemasimplified.org. So Tori, thank you for those questions. It's good to see everybody here today. Dr. Carlos, do you have anything you want to say before we close off?
No, thank you very much for the interview. I'm really happy to be here and to get the message out that the lipedema community have some new tools for therapy, and to analyze all the options that you have, and maybe you can give the ketogenic diet a try before more complex or invasive therapies are decided. So. We are very happy to be here, and I hope this conversation helps a little bit for the understanding.
I hope so too. And anybody, reach out to Dr. Carlos. As you can see, his email's scrolling right there. He can make an appointment with you, and he can answer your questions. And I look forward to seeing you again, Dr. Carlos, because I know you and I talk quite a bit. And I can't wait to see everybody else here at another time. Everybody have a wonderful day, and we shall talk to you soon. Bye-bye.